This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning, welcome into the program. I'm Dave Wilson. Joining us today from Mon Health, Dr. Kristen Statler, general and robotic surgeon. Good morning, Dr. Statler.
Good morning.
And we have Dr. Mark Johnson, general robotic and vascular surgeon. Good morning, Dr. Johnson. Dr. Johnson, you there? You know what? He's there, but he can't hear me. Let me, well, we're going to have to switch a couple of things around. All right, we'll figure it out. We always do. 800-76, that's a whole different line. That's a different show. Well, we'll continue our conversation with Dr. Statler since we know she can hear us for the time being. Dr. Statler, good morning. Thanks for taking some time with us. You've been on the show a few times. We'll remind folks about your background, where you're from, how you ended up with Mon Health.
Sure. I'm from here in Morgantown originally. I ended up with Mon Health because that's actually where I was born, and I wanted to come back home after training, and I absolutely love working for them. It's a lot of fun.
And specifically, you're a surgeon, but specifically, what do you do, and how did you end up down that road?
So I'm a general surgeon. I actually got into general surgery in medical school when I was doing the different types of rotations, and I absolutely love the variety that general surgery could do. We cover anything from head and neck procedures, the belly. We do mostly belly surgery, so gallbladders, appendix, colon surgery. We do a lot of minimally invasive, which is where we talk about robotic surgery and laparoscopic surgery. So I love, and breast surgery. So I love doing the variety of surgery that we get to do.
Did you always want to go into the medical field, or was that something that developed as you were going through high school and into college?
That started more in high school, to be honest with you. I loved chemistry, loved the sciences. My chemistry teacher, Mrs. Joyce, back then really encouraged me to go towards scientific exploration, and from there it kind of led naturally into medicine.
We're going to focus in specifically today on colon cancer, detecting, treating, the whole 9 yards. But you mentioned laparoscopic surgery. What is that? Can you explain to a guy like me who did not go to medical school, clearly, but explain what that is and what it encompasses?
So laparoscopic surgery, or minimally invasive, which includes robotic too, is a way of doing large surgeries through small incisions. So the surgeon still does all the work, but we use instruments that kind of help us to make little tiny cuts and still be able to do the big surgeries that we talk about, like removing the colon, taking out the gallbladder, taking out the appendix.
Talking to Dr. Kristen Statler this morning, trying to reconnect with Dr. Mark Johnson, fighting through a technical glitch here on this side. So Mon Health Medical Center is a center for excellence in robotic surgery. We're going to talk to Dr. Johnson about that. We're going to get into colon cancer, as well as March is Colon Cancer Awareness Month. That's all still ahead. We got to squeeze in a break. It's Mon Health Talk, and it continues in a moment.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
All right, we got things sorted out. Now we have Dr. Mark Johnson joining us, as well as Dr. Kristen Statler, both with Mon Health Surgical Care. Good morning, Dr. Johnson.
Good morning. Good morning, Dave.
Glad we finally got it all connected. We'll dispense with the pleasantries from the first segment. We'll have to go back, get those another day. I was talking to Dr. Statler before the break about laparoscopic surgery. How is that different from robotic surgery, which you specialize in?
Yes. So both of them are minimally invasive procedures. And for the topic of the month, for a colorectal surgeon to have access to minimally invasive procedures has made a big difference, because we've turned a procedure that was previously invasive and disabling with a lot of patient discomfort and a longer recovery time into a much more tolerable procedure. Shorter times in the hospital, quicker times recovering, getting back to work sooner. So it's made a big difference. And when you look at laparoscopic versus robotic, what the robot does is it gives us the opportunity to do things that we just can't do laparoscopically. So it extends our abilities in terms of the procedures that we can do, the techniques that we can use, and allows us to do more of those procedures minimally invasive than a straight laparoscopic case would allow.
And Dr. Statler, we want to get into our focus today. Colon Cancer March is Colon Cancer Awareness Month. What are some symptoms that can be signs of colon cancer?
So it's important to know that a lot of colon cancer, you may not have any signs or symptoms of it. So getting your screening colonoscopy is absolutely imperative. We start screening now at age 45. If somebody does develop symptoms of colon cancer, they may notice a change in the size or caliber of their stool, going from a normal size to a small pencil thin. Or they may notice their stool becomes darker or has blood in it. Those are some big signs that we really need to get you into a colonoscopy right away. Unintentional weight loss is another sign we look for.
And Dr. Johnson, you heard Dr. Statler mention to start screening at 45. I assume, and that usually gets me into trouble, but colonoscopies are the standard. But is that the standard screening? Are there other screenings that can also be done?
So the advantage of a colonoscopy, I think there's threefold. The first one is it's by far and away the most sensitive way of assessing the colon. The second one is, and because of that, the second advantage is if you get a colonoscopy and everything checks out okay, you don't need to come back for a while, maybe several years, depending on your personal and family history. The other advantage of a colonoscopy is if you go and have a colonoscopy and say we find a polyp, we can oftentimes remove that, removing the risk that polyp becomes something more ominous, all at the same time. But to answer your question, there are other mechanisms for screening, including regular examinations with your doctor. They can check for blood in your stool. There's a new fancy test called a Cologuard, which has gotten some advertising that's helpful. It's a non-invasive means of assessing for abnormalities in the bowels that might be suspicious for colon cancer. So those are available options as well. None of them are as sensitive as a colonoscopy, and not everybody should be getting a Cologuard, but it's certainly one of the things that can be done.
Screenings start now at age 45. In what instance should someone younger than age 45 get a screening, Dr. Johnson? Two reasons. One, certain health conditions we know predispose to an increased risk of colon cancer, conditions like ulcerative colitis and Crohn's disease. So those patients deserve more aggressive screening protocols. And the other one is family history. We know that anybody that has a family history of colon cancer, particularly in first-degree relatives, those people deserve more attention and an earlier screening protocol. And you mentioned polyps. What is a polyp if one of those comes up during a colonoscopy?
So the lining of your colon is continuously being shed and replenished. And unfortunately, during the process of that regrowth of the mucosal cells of the colon, sometimes you can have abnormalities, and those abnormalities can manifest as a polyp, which is a growth within the colon. Some of them look sort of like moss growing on a rock, and some of them grow like grapes on a vine, depending on the type of polyp, where it is, and so forth. And so there are abnormalities, and the biggest thing is that for several of those polyps we think are the beginning step in the development of colon cancer. So the difference is a polyp is a benign condition that, if recognized and identified early, can be removed. But if a polyp is allowed to grow, we think that eventually it's going to become a colon cancer, and then it becomes a much more challenging problem to manage.
And Dr. Statler, if you detect a polyp or detect colon cancer in the very early stages, I would imagine it's treatable. So how would you, or what kind of a general plan would be developed for a patient to treat an early stage cancer?
So if it's a very small polyp or precancerous, you can usually remove it at the time of the colonoscopy. If it's an early stage cancer, then we can plan the patient for minimally invasive surgery in most cases, remove the piece of the colon that has the polyp in it, and hopefully by catching it early, prevent them from needing any chemotherapy or treatment other than surgery.
And that highlights the importance of the annual screenings, the colonoscopies, to catch something in the catch something in the early stages when you guys can best get in there and treat it, and hopefully everything kind of goes back to normal.
Absolutely. Our goal is actually to catch it before it ever becomes cancer and treat it before we'd ever have to do the surgery to remove it. We could do it right during the colonoscopy.
Are there risk factors or behaviors or lifestyles, I guess, that could increase your risk for colon cancer?
Smoking is one that we talk about. It does increase your risk for colon cancer. Family history increases your risk for colon cancer. We are finding some association between obesity and colon cancer at this time.
Is there anything smoking doesn't increase your risk for? It's every week. I don't want to go on. I will not get on that soapbox today. How about that? Because every week, whether it's pulmonary issues, heart and lungs, colon cancer, don't smoke. We always end every show with don't smoke. I just don't understand why you get down that road. But I won't get on that soapbox today unless one of you two would like to get on that soapbox. By all means.
Think about what you're doing. I mean, obviously people smoke and there's an addiction involved with it, but exposing your body to toxic chemicals, whether it be in inhaled form or any other kind of form, is obviously not such a smart idea. And I think that's probably why smoking would increase the risk of a colon cancer. Likewise, eating a diet that's indulgent and has a lot of preservatives and so forth, we worry that maybe that's part of a contributing factor to colon cancer as well. So, the good old advice of, things in moderation and taking good care of yourself, eat healthy and be healthy, really applies to colon health just like it applies to everything else.
Before we take our final break, Dr. Johnson, if you do catch colon cancer and it is in a later stage, what treatment options are available? How do you go about handling that?
Well, that's one of the advantages, for example, of Mon Health Medical Center, is that we've got sort of a comprehensive treatment program available for patients who don't show up until later in their disease process. Surgery plays a role frequently, but not always. Oncology assistance in the form of chemotherapy is oftentimes very helpful. Radiation therapy is sometimes necessary, depending on the location of the cancer. So it's a multimodal treatment plan, and again, certainly, we make the argument that the early evaluations, early screenings, catching polyps before they become cancer is most critical. But even in later stages, we've had some remarkable successes in terms of managing patients with colon cancer. So there's every reason to be, to stay hopeful and optimistic, even if you're dealing with a bad problem like that.
Dr. Kristen Statler, General and Robotic Surgeon. Dr. Mark Johnson, General Robotic and Vascular Surgeon. Mon Health Surgical Care at Mon Health Medical Park. They are our guests this morning. We got to squeeze in a break. We'll continue the conversation in a moment.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
A couple of minutes left with Dr. Kristen Statler, Dr. Mark Johnson, General and Robotic Surgeons for Mon Health Surgical Care. Dr. Statler, what does follow-up and recovery look like, generally speaking, after a procedure?
So after a robotic or laparoscopic surgery, we usually see you back in the office in 2 weeks to make sure that incisions are healing. Slowly we'll return you to full activity and recovery. Usually I tell people about 6 weeks before they're fully back to normal. And then after that, we follow you up yearly with a colonoscopy until you don't have any polyps, and then it goes to every 3 years and eventually every 5 years.
I would assume your regimen or restrictions, that'll vary with the type of procedure, how invasive or non-invasive it has to be?
Yes, absolutely. So the people who get minimally invasive surgery, robotic or laparoscopic, usually get to fuller return to function within 2 to 3 weeks versus 6 weeks or more for open surgery.
And I'm sure, Dr. Johnson, you've heard from patients when you tell them, give them a time frame, stick to the time frame but doc, I feel better after just a few days. Why can't I go out and do what I was normally doing?
Yeah, for sure. I think it's, again, particularly with robotic surgery, the incisional pain is a lot less, and therefore people feel, they get rambunctious and want to get out and do things. But it really does take, your body's going through a major process, right? You're healing from a major surgery. And so even if there's less pain involved, your body still has to go through recovery. I usually warn people, hey, listen, it's going to be about a month when you're going to feel crummy, you're going to feel, not much appetite, not much energy. And then after about a month, the dust will clear, the fog will lift, and all of a sudden you'll start to feel like your old self again. So oftentimes there's a little bit of cheerleading involved in reassuring patients that they're on the mend and moving in the right direction.
How can people get in touch with you two? Will it be a referral from their primary care physician? Can they reach out individually and set up an appointment?
Both work. Oftentimes, working with your primary care provider, for example, to discuss, what's your best screening option is a good first step. But certainly, we'll take referrals from the primary care doctors, and we take calls at the office as well, and we can certainly help out if you need our help.
And you can, of course, find out more information over at the website. Go to monhealth.com/general surgery. Dr. Kristen Statler, general and robotic surgeon. Dr. Mark Johnson, general robotic and vascular surgeon over at Monhealth Surgical Care at Monhealth Medical Park. Guys, thank you so much for joining me here on a Monday morning. I appreciate it.
Thanks, Dave.
Thank you.
Hey, anytime.